Hello, welcome to my videos. This is Dr. Ravel Martinez with another tip for us foreign graduate veterinarians going through the ECFVG and the NAVLE exams to get licensed here in the US. So for today's tip, it will focus on one of the topics that I really like, which is surgery. So on the CPE exam, the clinical proficiency exam, one of the 7 parts of that exam is surgery, in which we will be asked to perform a spay on a dog. So here's my tip, and this will be a series of tips, but let's start off with the first part for today. So the main thing that I would always want in anyone who wants to do surgery, of course, is for us to get as much hands-on experience on how to do it. Of course, there's each state will be different. If we're still in our home countries, we might be able to get more practice there. It poses an issue sometimes when, just like me, I used to be an equine vet before moving here. So it's not something that I did on a daily basis when I was practicing. When I moved here and I found out, of course, that is part of the exams that I have to take to be able to get licensed here. So I started contacting local veterinarians in the state where I was. Of course, the Humane Society will always be a possibility of, see if they can offer training, if they can at least have you watch their surgeons. Some of them will allow it, some of them won't. I know when I used to be in the state where I was, which was Arizona, the the county shelter was before me was graciously enough to help students practice. Of course, there's also training that you can go through. There's overseas training. You can go back to your home country and see if there will be someone or some clinics from way back in school where your classmates who might be able to help you train for that. So today, the tips that I'll be discussing are tips that I would want you to learn by heart. Muscle memory will always be very important during the exam, especially when everything is just happening so fast, one after the other. All you have to rely on is your body doing what it's used to. At some point of the exam, of course, some of the stuff that you practiced but not really had muscle memory on, you'll be able to remember it, but try to make sure that you have a muscle memory on the main parts of the procedure. Again, I didn't have much experience with regards to space because I came from equine practice, but now I like it. I like doing space. I'm always challenging myself to be as efficient as possible with regards to tissue handling, with regards to making my incision as small as possible, of course, with the pet safety at hand, but as small as possible, making sure that I don't make as much mistakes that I used to before, and trying to make everything go through as fast as possible. So here are some tips for today's video. One of my main tip is make sure to figure out what size sterile glove you need or what size fits you best. Recently I've had to use a size that was smaller because the clinic ran out of my size gloves, and I tried the smaller size for me, and it's not good. It's really hard when your fingers are cramping, and it's also on the opposite side really hard if the glove is way too big for your hands. It's going to be a challenge to change gloves in the middle of the procedure if you ended up getting a glove size that you didn't like, that is not working for you. So tip number one, make sure to know what size gloves, surgical gloves you will need. The one that you will ask for when you're at the testing center. The next tip that I have definitely would be practice using the surgical instruments. Specifically, if you're not used to doing surgery, specifically how to use the needle holder, how to use which instrument. If possible, I would recommend, buy a set of instruments online. It doesn't have to be a really good quality. There's several options that are available on probably on Amazon, but try to get your fingers used to those instruments. It's going to be hard if you're trying to be very quick or very efficient if you're not used to those instruments. The other thing would be, if you're not that used to those instruments, especially the clamps, and you're trying to move the pedicle while it's clamped, and you end up putting your fingers into those holes for the instrument, for the one that is holding on to the pedicle, the clamps. If you accidentally put your fingers in there when you're just supposed to handle the body of it, there is a big chance, and I've seen this before with students, that you might release the pedicle. And that's going to be a really, really tough mistake, because now you'll have to try to find it. The other thing would be practicing scrubbing techniques. There's two types of scrubbing techniques. There's the timed scrub, and there's also the numbered stroke technique. So during the exam, the one I just pick which one you're more comfortable with, so you know how to scrub. Make sure it's up, always up. You're scrubbing all the way to the elbow. Make sure that you're aware. There's a lot of videos on how to scrub, but make sure you practice that. We don't want the simple mistakes to get you kicked out of the exam. And there's a lot of mistakes that could happen while you're doing this whole test. The other thing would be practicing gowning techniques. So that one I won't be able to show you here, but I will be on my channel. There's a list of videos that is very helpful, that really helped me when I was studying for the exam. It's just you have to memorize it. You may have to have your body get used to how it's done. Asepsis is the main thing, and breaking that would cost you the exam. So make sure that you're very well aware of your surroundings. I would always recommend, if this is not something that you're comfortable with, go and buy a surgical gown so you can practice how to use it. Practice to find where that the collar is, where you can touch it, where you're not supposed to touch it, just so you build that muscle memory. The other thing would be, and it will be included in the videos that I will be adding up to my playlist of the videos that help me, would be the surgical site preparation, which is basically shaving the belly all the way from the sternum down to the groin area. And typically for me, for a medium-sized dog, I would want it to be one blade size on each side of the nipple, to make sure that we have that really big surgical site that we're working with, just in case we need to extend the incision. Just in case. Worst thing is, you have to extend the incision, but it's not prepped properly. So that will cause a lot of issue. Hair will grow back. As long as you're not burning through skin with a hot clipper, then it's perfectly fine. Hair will grow back. Having said that, make sure to when you're shaving the fur, make sure that to check the clipper and make sure it's not too hot. The other one would be, and this is my favorite, and I learned this when I was at the shelter. Make sure to always try to empty the bladder. If the bladder is full, and that will be the place where you're trying to make your incision, your knots, trying to get the uterine horn, trying to get out the bifurcation. If you think about it, that's on the same area as the bladder. You don't want to be dealing with a full bladder while you're doing a spay. So that's my other tip. And another tip that I always am very peculiar about and I'm always focusing on is making sure that when you position the pet, it is super straight. No tilting to the side. It has to be really, really straight. I cannot stress that enough, because if the pet is positioned properly, when you make that first incision, you'll see the linea alba. It's really bad if the pet is tilted to the side, you make that incision and you can't find the linea alba. The linea alba will be midline. Trust me on that. That's where it is. So these are the first tips. I'll be listing several tips as well on the next part of this series of videos specific to the CPE surgery. So again, don't forget, I have a Facebook page. It's DVM Rovel, ROV as in Victor, EL. Like my page here on YouTube and follow me on YouTube so you can see the next set of videos that I'll be posting. Again, good luck to all of us who's studying so hard to get licensed here in the US for ourselves, for our families. You can do it. You just have to focus on the goal. It's tough, but focus on the goal, and someday all of us, you'll get licensed. So it's worth all that effort. Thank you very much. Bye bye.